Dr. Wagner.
Thank you for having me.
So we're going to talk a little bit about orthopedic surgery.
Yes, ma'am.
Okay, cool. Let's start with who your most common patient is.
My subspecialty is in hip and knee replacements. We call it adult reconstruction. So the majority of my patients are more elderly patients that are getting slowed down by time and overuse and pain in those achy joints.
Okay. All right. So pain and the achy joints are usually the indicators for them to come and see an orthopedic surgeon?
Most of the time, I am the second line of defense, if you will. Most people will start with their primary care physician, but everyone out there has a family member or friend that has similar types of symptoms that says, you have to go see so-and-so. My job is to keep people moving. So, joint replacement surgeons are a long-term career, if you will. We see the patients and hopefully can push them off and towards any surgical procedure for a long period of time, but we do what we can to kind of start low and build from there.
Okay. So what are some of the things that you find your patients start to feel initially? Like, is it arthritis or is it just a back pain or a hip pain? What will get the process started from a patient point of view?
Most likely it's they are able to do some activity, whether it be golf, long walks, tennis, you name it, that they're just unable to perform up to their normal comfort level or what they normally like to do. It can be associated with stiffness, inability to do certain activities, or one of the most frequent is obviously pain. It can tend to start localized in certain areas, but as time tends to do, it catches up with all of us and it becomes more global from there, most likely.
Okay. And so tell us a little bit about some of the newer technologies that you're using here at McLaren to assist with treating people who need your work.
Technology, as it is in almost every sector out there, is become a boon, if you will, in the orthopedics department. A saying that I like to say is that a robot or technology has never gone into a certain area and then been taken out of it, and that is true in orthopedics as well. Here at McLaren Macomb, we are lucky enough to have the Macoplasty technology, and to the untrained eye, it might not seem with much, but the way we can make our joint replacement procedures, particularly about the hip and the knee, last the longest is to put them in properly. Okay. That leads to better stability, better function, and through better function and form, we have better outcomes. Okay.
So the greatest benefit to the patient who might have robotic surgery is accuracy, or?
Too long in the orthopedics realm, we were placing everybody into the same box. If you had knee arthritis, you were placed into the knee arthritis box. And it probably took us longer to realize than we should have that we need to have a more individualized approach. Okay. And the robot allows us to do it. Down to a simple millimeter or simple degree, we can correct the deformity specific to that particular patient. Mm-hmm. Getting that leg straight, getting the knee moving, getting the hip moving are all ideal situations to get you back to your life, to your activities that make you you.
Okay. So then from a doctor's point of view, you're servicing your patient greater and providing a more specialized care. What else?
Well, the information that we put into the robot is the robot's only as good as the information that we put into it. So it's still prudent that we recognize each deformity. And I had a trainer of mine that used to say there was the science of medicine and the art of medicine. And the art of medicine is, the reason we call it a practice. It's something we refine over years and years of our career, and the reason our training is so long. So by doing hundreds and thousands of these procedures, we can hopefully have the best outcomes for all of our patients.
Okay. What advice would you give all of our viewers who are growing older, to help them maintain a healthy back and knee and hip and things of that nature?
Well, it seems counterintuitive, but my number one thing that I always tell my patients is to keep moving. Mm-hmm. Oftentimes people think if they stop moving, they'll feel better, but it's a true if you don't use it, you'll lose it situation. In regards to the hips and knees, they are very much a wear and tear joint. So that when we get weakness through those joints, we tend to see them break down even quicker. By keeping the muscles that surround the joint strong, by keeping appropriate stretches and range of motions, is the number one thing we can do to improve joint health. The same could be said both before surgery and after any surgical procedure.
Okay. Does diet play a role in it all? in your area?
It does. There are some inflammatory foods, and a quick Google search will obviously tell you everything's going to be bad for you, but a healthy, balanced diet and a healthy weight will provide less stress across both the hips and knees. Every pound we're overweight is actually 5 pounds across the knee, so you can imagine those forces add up quickly.
What are some of the concerns that a prospective patient might have, as they are contemplating whether or not they want to go through with the surgery?
And it's very valid for patients to have some concerns because this is a major procedure, but it is also an elective procedure at the same time. We have a very refined approach to how we address hip and knee replacements in particular. People often are concerned that the pain will be unbearable or the recovery will be long and lots of work. And again, it goes back to setting proper expectations for the patient. In regards to the pain, we take a multimodal pain approach with nerve blocks and local injections and oral anti-inflammatories and when needed, pain medications for a short duration of time. But as we continue to rehab, the knee acts like your knee again. And if you didn't need pain meds before, oftentimes after 6 weeks or so, we typically don't require any from there. The general overall concern is life doesn't stop. People have work, they have family, they have parties, they have holidays. So there will never be an ideal time to get your joint replacement done. But more often than not, I do have patients say, I wish I would have done it years ago. I don't like that approach to it because I don't like the woulda, coulda, shoulda game, but when it's right for you, you'll know. My philosophy is I will never ever tell a patient they have to have a joint replacement done. I'll tell you when it's an option, and you'll tell me when you're ready.
Doing the robotic surgery, does it result in quicker recovery times, or what other benefits would a patient see from this type of surgery?
Well, there are multiple procedures that we can use the robot for. In particular, the partial knee replacement has seen the absolute quickest return. It's a smaller incision, a shorter operative time, less bony work, less soft tissue stripping needed to perform the procedure. The vast majority of our partial knee replacements are going home as the same day of their surgery. Most walk into my office at 2 weeks with no crutches, canes, or walkers. Most are back at their jobs inside of a month. My quickest is I had a patient water skiing at 3 weeks. It might have caused a little chest pains for me, but he was happy.
So aside from backs and knees and hips, what other areas do you work on? Is it fingers and toes and...
I am also on the trauma schedule here at the trauma call schedule here at McLaren, so I do a lot of fracture care. Unfortunately, we see way too many elderly hip fractures, but there's no use worrying about what's done is done. All we can do is move forward with the best treatment options possible. Ankle fractures, general hand procedures, and I do a large percentage of shoulder surgeries as well, both arthroscopic and arthroplasty procedures.
Okay. I had a personal incident occur where I fell, and it just showed me how really amazing the body is. I fell, and it was a pretty, significant blow to the knee. Yes, high heels. No friend of mine.
I don't know how you do it.
And my knee started to grow extra bone, and it was really interesting. So I had to go in, and they had to remove the extra bone. So I think my knee thought that it was broken, perhaps, and was starting to heal itself.
The body only knows how to do so many things, and one of the things it does do well is form bone. Bone is actually the only tissue in the body that heals with more bone. Everything else heals with a scar.
Okay.
So with bad injuries to muscles or around the bone itself, no different than you would see a bone spur around arthritis. Every now and then the body says, hey, I'm going to throw some bone down here. And unfortunately, it's kind of like a snowball rolling down a hill. The body sees more bone, sees it as more injury, so it lays down more bone, and it can be a very vicious cycle.
Right. Yeah, I was really relieved to have that taken care of.
Yeah, real weight off your chest.
Is it likely that a patient, after visiting your department and having surgery, will be able to return to their full activity?
Managing expectations after a joint replacement is a very important part of my role. I like to tell patients, I'm going to cause you more pain before I cause you less. Too often in orthopedics, we were quick to pat ourselves on the back if the knee came straight and bent back appropriately. But there were a lot of people that just kept thinking, man, I've got a partial knee or a total knee. By managing those expectations, we set a more appropriate reality for these patients. And with time, the vast majority of my patients anyways do get back to doing those activities that make them new. I have no problems with golfing or tennis, or pickleball seems to be all the rage these days. You will occasionally hear people say you cannot kneel or run or jump on a knee replacement or hip replacement. I don't have any restrictions for you. My job is to get you moving again. And if those are the things that truly make you you and that you enjoy, perhaps you might wear your knee or hip out a little bit quicker, but you'll live life a little more fully as long as I don't give you any restrictions.
That sounds fantastic. Dr. Wagner's the doctor to see, huh?
I'm happy to help in any way I can, but our role has been such a team-based approach, and I am just one member of that team, so I couldn't do it without the joint program that we have here, the McLaren Macomb, and I think we do a pretty good job in that regard.
That's fantastic. Thanks so much.
Thank you.
To learn more, visit mclaren.org/Mako.